Welcome to all in attendance. Thank you for taking the time to attend DISYS and Automation Anywhere's webinar on healthcare automation for providers, revenue cycle management. In today's session, we aim to provide you with key insight on how digital technologies like robotic process automation, AI, and machine learning can help transform some of healthcare providers' processes to bring in better operational efficiency and improve patient care. I would like to introduce today's presenters. Dr. Yan Chao, Global Healthcare Industry Leader of Automation Anywhere, and Mr. Jiri Raja, VP Healthcare and Life Sciences with DISYS. Dr. Yan Chao was recognized by Healthcare IT News as one of the top healthcare innovation leaders in the US. Dr. Chao holds 3 US patents and has been an invited speaker at industry conferences. Formerly, Dr. Chao was a medical director for digital medicine at Amgen, leading the implementation of digital initiatives in clinical trials. And he is also formerly the national director of the Innovation and Advanced Technology Group, IAT, at Kaiser Permanente. Mr. Jiri Raja is responsible for fueling DISYS growth through innovative healthcare domain-based solutions that address key industry issues through strategic partnerships with technology companies. Mr. Raja has also led large digital transformation practice groups and brings more than 25 years of experience driving multifold growth across industry domains, including healthcare and life sciences, the US federal government, and state health and human services departments. Before we begin, I'd like to share with you a few ground rules. All participants will be on mute. If you have any questions, kindly post them in the chat box. We will answer them during the Q&A portion. All participants will receive a copy of the presentation as well as a recording of this webinar. To begin the presentation, I present Mr. Jiri Raja.
Thank you, Sandra. I appreciate that. Welcome, everybody. Good to virtually connect up with everyone. So quick agenda for today. For next 30 minutes, we will start with healthcare automation perspective and the experience that Dr. Chao brings to the table on the revenue cycle management. And followed by that, we will present to you D4HA, which is DISYS for healthcare automation. And we will probably take you through 3 of the scenarios from a demonstration perspective. One is claim status check. Second one is eligibility verification. Third one is patient registration. Followed by that, we'll give a quick snapshot in terms of who DISYS and who Automation Anywhere is. And then we'll open up for Q&A. As Sandra mentioned, feel free to shoot your questions on the chat box so that at the end of the session, we can address all the questions that you might have. Again, I appreciate your time today. With Dr. Chao.
Yes, thank you, Gary. Appreciate being here and being invited to participate. As the audience probably knows full well, 2020 was a truly pivotal year in healthcare. The lessons we learned from that in our company and other companies is that we need to drive digital transformation, and transformation in most companies in healthcare typically starts with automation. So for instance, telework, telemedicine are the new normal. How do you set up remote workers quickly and accurately? How do you give remote workers a full arsenal of tools they don't have to spend weeks to learn? Access, affordability, the patient care experience. How do you efficiently provide access in an affordable, high-touch, high-quality way, especially with televisits? Visibility into organizational performance. This requires interoperability across multiple legacy systems that are not usually designed to work with each other, and this has always been an issue in healthcare. Staffing shortages are really put into focus by COVID-19. How can you increase worker productivity and reduce burnout? Healthcare workers say that over 60% of their jobs is paperwork. Scalability in a volatile economy, even today, a year later, a lot of uncertainty on the horizon. A digital workforce is actually more easily scalable than a human workforce. There are no onboarding costs or delays. And this actually frees up healthcare workers for things only they can do. The next slide. So the question is, what enables digital transformation? I like the quote above, you can read it. But the first step is understanding the process discovery. A key step to understand how your organization works and how to prioritize the right processes in terms of feasibility, complexity, and ROI. Automation Anywhere, my company, provides several ways to assist. And there is something called Discovery Bot that can observe people at work, record what they do, and generate a bot framework. The next step is how to optimize that process by identifying metrics and KPIs, building and validating the business case. And here we also have several tools to help make the design process easier, including very sophisticated document handling. The next step is implementation. We have industry-leading security and governance that enables centralized administration as well as maintenance and support. In healthcare, we can also generate a highly granular audit trail for quality, safety, security, and compliance reporting. Next is analytics, a critical part of today's modern healthcare system. Data is collected almost everywhere, much more so since the advent of the EHR, electronic health record. How do you aggregate, curate, get actionable insights, and produce reports on automation? Our platform includes a module called Bot Insights that can help do that. Next step is improving the process automation, not just from analytics on bot operations, but also by leveraging other available validated bots that are shared in your private bot library or our public bot library to understand how to optimize bots. Many customers establish a center of excellence to build central expertise and experience. And we also have a user forum for customers to share their experiences. And finally, and just as important as anything else, is the upskilling and reskilling of employees for higher value work after their manual tasks have been offloaded by automation. And of course, we offer a university with different certifications, and we offer a free community edition to learn with. So it's very, very helpful. Next slide. So when I think of automation in healthcare, I think of 6 broad categories of use cases. And these are opportunities by objective. Objectives being to reduce costs, increase productivity, reduce delays, improve patient experience, manage risk, and gain insights. So Automation Anywhere has worked with healthcare customers for over a decade. And most solutions, to be honest, have been in the back office, typically finance and HR. So these are the 3 columns on the left. Improving cost, productivity, and delay. And there has been significant ROI in document data extraction, revenue cycle management, prior authorization, employee onboarding, and so on and so forth. As you can tell, these are manual, transaction-heavy, rules-based tasks that people actually hate to do. But this is just the tip of the iceberg. The 3 columns on the right are where healthcare organizations are starting to focus today. And many other potential use cases come to mind when you look at what an intelligent bot can do, and this has been a change in the last couple of years, is that AI has been added to these bots. In the improved patient experience category, bots can relieve patients of administrative burden by automating data collection and form completion. They can enhance self-service systems, including scheduling. They can check benefit eligibility. They can enhance the call center and many other areas. So intelligent bots can identify patient patterns and even predict likely needs and preferences. Under managing risks, bots can monitor many things that need to be monitored in healthcare, like quality, safety, security, regulatory compliance. A bot can record who used it, what permission was used, how long it took, what decisions were made, and what the outcome was, and generate a very highly detailed audit trail for regulators. A bot can also enforce protocols to reduce risk, such as transfer protected health data securely without involving employees, so you reduce the risk of security breaches. And some organizations are using bots to start detecting fraud through machine learning, which is very interesting. Finally, under gaining insights, automation can address one of the essential problems I mentioned, which is a lack of interoperability across systems. And this long-standing barrier has blocked things like financial forecasting, coordination between different departments, projects in quality of care, patient safety, operational efficiency, and even analytics. So automation can build a dashboard that has visibility across the organization develop composite KPIs, generate alerts, and so on and so forth. Very, very useful. So it's an exciting time for automation in healthcare. We're starting to get into the real healthcare stuff, and I think it's a great journey to be on. So I encourage you to help us to join us in that journey. So back over to you, Giri.
Thank you, Dr. Chow. That's really insightful. We're barely scratching the surface in the healthcare in terms of leveraging automation. That's really awesome. Thank you so much for that. So with that, I just want to give a quick, this is Giri Rajia from DISYS. So want to give a quick snapshot in terms of, looking at all the potential opportunity that we see and what automation can bring to the table. We built something called DISYS for Healthcare Automation. It's basically a prepackaged solution with the automation functions that is very attuned to the healthcare industry. There are three broad elements that we are building with D4HA. One is optimizing the revenue cycle management, which is what is a session for today that we will be going over a few demo sequences for you to understand, what the benefit you can quickly get. And the second one is a seamless contact center process, how we can automate those processes. And the third one is enhancing the supply chain operation. So there's multiple things like Dr. Chow mentioned, we have used RPA, we used OCR, we used AI ML techniques in terms of, picking up some of the unstructured elements of the business process to automate that. So it goes beyond just pure play process automation, right? And we will go through that in detail. In the meantime, we wanted to also give a snapshot in terms of the revenue cycle management. Dr. Chow already mentioned various elements that you can leverage in terms of bringing business benefit for the organization. If we look at revenue cycle management and bucket it in 3-4 areas like the pre-claim and patient encounter, the transaction, the AR follow-up, we picked up 3 areas which we feel there's a high impact for getting return on investment for automation. So one is on the claim status check. The second one is eligibility verification. The third one is patient registration, more so to patient demographics. This is just a snapshot of that 3 elements which can quickly get the returns for the providers. And there are multiple other elements that you can automate using the technology that's available to us today. So with that, we will look at the first one we wanted to showcase to you is the claim status check, right? So D4HA, we have created an automated workflow and that can validate this claim status and submitting valid only pending claims. So normally this is very manpower heavy, and we have seen that on average, the industry could save around $9 per claim status check by way of automating these processes. Second thing is that we can utilize these bots to run claim status check, and we can improve the productivity, and we can increase approximately from 600 to 1,000 transactions a day while reducing the full-time equivalent manpower by 80%. This is a significant ROI for customers, and you'll see it in the demo that the sequence that we are going to show is that we log into a billing system, search for a payer, because the providers work with multiple payers, and we just click on the claim status check and it pulls the record on pending claims and submits the pending claim back to the system. So the bot can do the digital workforce that Dr. Chow was talking about. With that, we will go through, we've created a virtual demo so that's easier and quicker for people to look at that demo sequence. That was the quick demo on the claim status check, and we hope for G4HA we can remove the approved claims from back office work queues instantly, and also eliminating the need to follow up with majority of claims that is there. So this one process itself can bring in a lot of benefits for the providers in our perspective, because it decreases the time and effort, it increases the approval process and authorization, and it's got a solid projected return on investment of around $1 million for a reasonable sized organization. Let's look at the second one, which is the eligibility verification. And this is again a very critical thing from insurance verification, because accurate eligibility confirmation, we can help streamline claim submission and reimbursements from health plans. So we hope that it helps in reducing claims denial, which is a big problem with the providers right now. So we can get reduced denials from the payers due to accuracy of capture of information on the front end. That's what we are trying to achieve here. And by automating this eligibility verification, we can improve the accuracy of information submission by 25% while increasing the transactions per day 4 times with a reduced fixed like FTE cost, full-time equivalent manpower. And in this demo, we will look at receiving an insurance form from the payer for the verification, and download that form and then put it. The bot analyzes and extracts the information. Again, these are some of them could be even unstructured documents, right? Not like a structured document. And we can convert that information into a structured data, like an Excel data, and upload to the data into provider billing system. That's what we will see in this demo as well. So that was the eligibility verification that you So, and it actually reduces a lot of those manual errors in eligibility verification. And as I said earlier, it helps in reducing the claim denials. So decrease time and effort in the business, reduce approvals and authorization. It shortens billing cycle and also increases staff productivity. With that, we'll go to the third one, which is the final one we wanted to show today, which is the patient registration and particularly the demographics. It's very important. We capture it early on and update it. And studies show that medical practices lose as much as 7% of their annual revenue due to errors in demographic data capture. So if you can do it early on and have the right data, it again helps you, like the previous scheduling that you saw, in terms of denials as well. So we can avoid claims denials with correct patient demographic. And as per 2019 MGMA, the stat poll indicated 31% of the claims were denied due to missing patient information. So this is again a very critical front-end process that we can automate that can bring in significant ROI and benefits to the providers. So the demo that we will see right now is how we take the structured patient details from a shared folder, log into an EMR, add new patient there, and update the demographic and update the insurance details and save it. That's what this final demo will show you. So that was the final piece of the demo that we had for patient registration. And as you have seen that it increases physician utilization, reduces the claim errors, and increases staff productivity a lot. But ultimately, I think the digital workforce, as Dr. Chow was mentioning, the simplest thing is that it is faster, it is simple to use, it frees up a lot of human tasks, which is mundane in nature, thereby bringing a lot of efficiency, and it's error prone, right? So like, we can reduce the errors that, manual task normally, does in business. So that is a snapshot that we wanted to showcase today. But as we said and Dr. Chow explained, this is just the scratching of the surface. There are so many other elements the providers can benefit with automation. Just a quick snapshot about who we are talking to. Automation Anywhere, they are leaders in robotic process automation. They have more than 4,000 enterprise customers, presence in 90 plus countries. Their bots is deployed across 2.8 million bots that's been deployed in the various enterprises. And they have 1,200 plus bots readily available. So what we showed was very business centric, but there are a lot of other back-end process Dr. Chow was mentioning in terms of HR, onboarding, finance, transaction, that's already available for customers to plug and use it very quickly. So that 1,200 plus bots is available to the customers to quickly use some of the generic horizontal, as we call it, bots from the bot store as well. And they are recognized by several of the leading research analysts like Gartner, Forrester, Everest Group, and others. And if you look at DISYS, and we are about $413 million in revenue in 2019, we probably crossed the $500 million mark this year. And we are a minority business enterprise. We are based out of the US, based out of the DC Metro, Northern Virginia area, and we have presence across the globe. In the US, we have more than 35 cities we have presence. We have 45 plus global locations, and we are also CMM level 5, SVC2. We are one of the first organizations to be certified. So it's a very high quality kind of organization. And in the healthcare, we what we call the connected healthcare ecosystem, we service a whole bunch of customers, Fortune 500 customers, and smaller customers as well, across the provider, payer, pharma, life sciences, PPMs, med devices. So we understand how this connected ecosystem in the healthcare is working. So it's a reasonably sized company with strong roots on automation. A quick snapshot is that a large Fortune 500 company, they said in a short amount of time, DISYS team was able to make a huge impact and difference for the business. So with that, it's a good handshake, from your perspective. If you look at automation and anywhere and DISYS, both brings in benefits. Strong companies, automation anywhere, as I mentioned to you, they're the only cloud native microservice web-based architecture. So they have a strong technology platform. They're the most deployed automation solution in the world right now. And they have more customers. They have pre-built bots that you can leverage from a DISYS perspective. We are a sizable company. We are a global managed service provider who's been working with very large healthcare companies as well. In fact, we are actually managing one of the largest automation programs for a Fortune 10 healthcare company. And so, we have credentials to help any customers of any size. And we have more than 500 plus consultants working in the healthcare domain space. More importantly, because of our roots on heritage and automation and cognitive intelligence in the last so many years, we have built our own, kind of native accelerators that we bring to the engagement, like the Botlizer, Bot Pilot, and Bot Desk, which goes throughout the entire life cycle of automation, right? From identification of a business process that a particular provider can kickstart with, and taking all the way through monitoring the bots 24/7. We have tools that we have built internally that we bring to your benefit. So thanks for the time. So this is all we got to have for today. Appreciate again all your time, and Dr. Chow for your session as well. With that, we will, Sandra, back to you for the Q&A.
Great. Thank you, Jerry and Dr. Chow, for that very insightful presentation. We have some time for a few questions. The first question we have: where have you installed or implemented healthcare automation solutions? Can you give one high-level example?
Sure, Sandra. I'll take it up, and if Dr. Chow wants to add on to that, he can do it. It's an excellent question. So the very purpose that the way that we have built DISYS for healthcare automation as D4HA is based on our customer experience. So we have multiple customers that we work with. So one of the customers is a leading provider in the West Coast. And when they started off this journey, we actually did a process consulting for them to understand where we can actually start the automation program, because they were in a journey. Because automation is a journey. It's just not you buy something, you install it, and you're done, right? So we started off in an early stage identification, discovery of a process that will bring the best return on investment. And one of the areas that we picked up was billing. And that was a good area because they started this project before the pandemic, but when the pandemic hit and their business started growing like 2 times, 3 times, they would have found it very difficult to handle those billing in this pandemic scenario without automation. It was humanly impossible for them to bring in relevant talent every time the business was growing 2, 3 times, right? So that is one of the customers that we have been doing it right from start of identification process and bringing the technology, implementing it. And they've now gone to a mature level of setting up a center of excellence. They are building another 8 more bots for different areas of the business as well. Dr. Chow, you want to add anything from your side?
Yeah, I think I think you guys have done a tremendous job in healthcare, and we're really glad to partner with you. But speaking to the question, I think there's actually a learning curve for automation. And most of that, I would say the vast majority of that learning curve has to do with understanding your own organization. The technology is not hard to use. In fact, it's very easy to use. And Automation Anywhere actually focuses on allowing business users to participate as well. So the interface is very good. But the self-awareness, sort of defining your processes, where the exceptions are, who's running the process, those kind of issues, prioritizing the process for the lowest hanging fruit and so on, that takes time. And so if the process is simple, it may take only a couple of weeks. If it's very complex, it may take a while. So it's a journey, and so as you mature, you start to understand what can be done. There's, like Gary said, there's tremendous potential. Yeah.
Thank you, Dr. Chow. I also I forgot to introduce, there's a couple of panelists available as well. So I have Arvind, who's our automation practice leader based in the US, and I have Parthiban, who is the subject matter expert from DISYS as well. So just want to make sure that the audience knows there's a few more people that they can point questions to.
Great. Perfect. The next question we have is a two-parter, and I know we just touched on the fact that this is, a journey, but a participant asked, how quickly can D4HA be implemented, and what are the system requirements for implementing D4HA?
Thanks, Sandra. I think that's an interesting question as well. And again, as Dr. Chow said, it all depends upon which business process we are picking it up, right? So if it's a simple bot that needs to be built, we can do it in 4 weeks, or maybe even 3 weeks or 2 weeks, right? And if it's a medium complex bot, it might take 6 to 8 weeks. And I've seen, for a large healthcare company where we're managing the Center of Excellence for bots, one particular bot, it took literally 5-6 months to build it because it's a very, very complex bot. So it again, all depends upon where we start the journey, right? But roughly around 5-6 weeks, you can get a decent sized bot running. And on the question in terms of what is required, so the automation platform is available both on the private cloud as well as an on-premise kind of environment. So both are available for customers.
Also, I'd like to add that your implementation model can vary depending on how much of a role the organization wants to play, either the entire role or just only have a partner implement it. So there's a huge variety of different, as far as the IT resources required, the organization resources required. Mm-hmm.
Absolutely, absolutely.
Mm-hmm.
Great. We have another great question. How do we calculate ROI or measure automation success from D4HA?
Okay, so I think there's multiple tools available from partners like Automation Anywhere. There is a very defined return on investment templates that we go through that involves multiple data points in terms of the current assist model, how much of time is taking to do one claim. Again, there are different level of maturity in an organization, right? As Dr. Chow said, some organization could be very mature and they have some processes very structured. Some organization may not have that maturity. So it all will depend upon, that maturity level, the process, the time it takes, and things of that nature. We can definitely take it offline and discuss more in detail about the ROI template that's available. That's what we normally leverage in engagements.
Right, and I think there's a lot of that process of value engineering that we can also bring, and we can throw some insight onto what other customers have done. But the metrics that you want to measure, they're really important because you want to have early success. So people have measured things like FTE cost savings, reduction in cycle time, accuracy improvement, things like that, which are pretty straightforward and easy to measure. Yeah.
Absolutely. Arvind, do you want to add anything to that? I know we had done a lot of this kind of ROI work with customers.
Yeah, sure, Giri. So, just in terms of getting up to an ROI number, I think the key factors are the FTE savings and the savings you generate from reduced number of errors, like Dr. Chow pointed out. And there are other factors like how many denials you're able to avoid for the denial management specific use case, right? And also other compliance and customer satisfaction. So I think these are all key KPIs that we track to measure ROI.
Thanks, Arvind.
Great. Okay. Well, we want to be respectful of everyone's time. It looks like we have a little bit more time for one more question. Can you speak to if someone's interested in getting started? What would be our first step? What does that look like?
So I think again, this is again depends upon the organization as to what they have, what they want to achieve, and the starting point. That's one of the advantage of D4HA, right? So we have a lot of things that's pre-packaged for the business, from a provider-centric perspective, right? But there are also a lot of bots available that we can quickly leverage and customize to that customer's requirement, right? Some of the generic bots that's available. So, in my experience, in our overall collective experience, I think 1 or 2 weeks we can quickly get things started. But if they already identified the business process, it's much more easier. If they have not and they need help in terms of identification of business processes, then it might take a slightly more time in terms of working with them to identify the business process. As Dr. Chow mentioned, the discovery process is super important, right? You need to understand which business process we need to pick up and what kind of ability that I have to implement that. So from our perspective as a service provider, as technology providers, we can bring all the heavyweights that's required, but if the organization is not ready, we're not going to be successful. So that's super important for us to understand the maturity of the organization as to what they want to achieve.
Great.
Yeah, and I think it's really important that usually when we first start an engagement with let's say a new prospect, somebody who's not done RPA before, it's usually on a very exploratory basis. And so a lot of it, like Gary was saying, is process discovery, understanding where the pain points are, what the priorities are for the organization, and what that particular application is focused on and where it came from, what level of the organization. And then we usually have a couple of meetings just to understand that and to present sort of an RPA 101 if the organization is very new to RPA, just to understand what it is and what it can do, what it cannot do. And then we go from there. And I think one of the things we can do is bring a framework. Giri has frameworks for how do you mature as an organization. When do you develop a center of excellence? When do you do sort of bring the business users in, and if that's what you want to do, and things like that. Yeah.
Thanks, Dr. Chow.
Mm-hmm.
Great. Well, that concludes our webinar on healthcare automation for providers' revenue cycle management. Thank you for joining us today. A quick reminder, all participants will receive a copy of today's presentation. Thank you, everyone. Take care.
Thanks, Sandra. Thanks, everyone. It was a good, interesting session. Thanks, Dr. Chow.
Yeah, thanks, Gary.
Have a good one. Bye-bye.
You too.